Hi, I'm Dr. Mark Andrew Holacek, philosopher and historian, Thomas Jefferson scholar. Today I'm going to do the third in a series of lectures on Thomas Jefferson as a philosopher. The title of the series is the Sentimental Traveler Lectures. Today's lecture concerns Jefferson's views on medicine. The title is A Pious Fraud versus an Adventurous Physician, Jefferson's Mistrust of the Physicians of His Day. Now, medicine in Jefferson's day advanced much from the medicine that was practiced in antiquity, but it still labored under the notion, the ancient theory of bodily humors, humoi in Greek, that translates roughly into something like flavors or juices. According to the author of Affections and Diseases, the number of the humors were 2, bile and phlegm. According to the Hippocratic author of The Nature of Man, and according to Galen, there were 4: blood, phlegm, bile, and black bile. So before talking about Jefferson's views, it's important to say something about ancient medical practice first. Now, there are many schools of thought in ancient medical practices, and these schools of thought lined up neatly with schools of philosophy. There was a Asclepiadean practice that lined up with Epicurean atomism. There was Methodism, which lined itself up with Pyrrhonic skepticism. Pneumatism lined itself up with Stoicism, and eclecticism lined itself up with philosophical eclecticism. There were debates between the schools, the medical schools, as there were debates between the philosophical schools. For example, the Epicureans often debated with the Stoics. Now, alignment, of course, dictated theoretical orientation to medical practice, even though all schools in general approached the nature of disease the same way. Each school thought, in some sense, as in philosophy, vice was considered to be a certain unhealth of the soul. So physical illness, according to any of these schools of thought, was considered to be a sort of sickness of the body. Okay, so the remedies that humoral practitioners used were riddance of excess of any of these humors, accretion of defect, riddance of blood, phlegm, bile, black bile. Health is chiefly the state in which the constituent bodily substances are rightly proportioned in strength and number to each other and are well mixed. That comes from the author of The Nature of Man. Okay, so the practitioners not only had to know the nature of the human body, they had to know the season of the year, the winds, the climate, the waters, and all these things and how they affected health. So there are all sorts of elements that went into understanding even a person's occupations. Medicine was generally taken to be a science, and the Greek word was techne, which can be translated as science, but it also can mean something like a craft or a skill or even an art. But the word techne does imply rationality, does imply that it's rule governed. There are rules that broadly define its practice. Theory sometimes dictated practice, and theories sometimes yielded to practice, to careful observation of a disease over time. The author of the Hippocratic treatise Prognosis says that a physician must study a patient's face. He writes, if the eyes shun the glare of light or if they involuntarily weep, the manner of sleeping, bowel movements, appetite, posture, breathing, and temperature. Okay, some of the methods used for treating disease were bloodletting, expurgation, emetics, suppositories, bathing, plastery, ointment, surgery, and especially regimen. And a regimen included exercise and diet. Now, there was one large debate in antiquity that Galen especially brings to our attention, Galen in the 2nd century A.D. This concerned dogmatism versus empiricism. Dogmatism is sometimes called rationalism. Now, the dogmatist thought that understanding disease was a matter of ascertaining its causes. Writes the author of The Science of Medicine, every symptom will be found to have some cause, and if it has a cause, fortuity can be no more than an unknown word. That's some ancient dogmatic practice. There are causes, we ascertain the cause, we understand the disease. Some of the methods, the employed principles, dogmata, where opposites cure opposites. Each disease has a natural cause, and causes of disease beyond what is apparent to sight must be ascertained through a sort of inferential reasoning, which was known as logismos. Now, empiricists believed in using experience, empiria in Greek. They didn't think that diseases were related to causes, or probably more precisely, they were just indifferent to the whole notion of causes. They used personal experience of similar cases, reports of other doctors, hunches, even dreams to suggest the course of cure. Neither school of thought was, both schools of thought, I should say, were fallibilists in the sense that it was a young science, and trying to get the science off the ground, the doctors in both schools certainly made mistakes. And they weren't shy about owning up to that, writes the author of Ancient Medicine. I warmly recommend a doctor who makes small errors. Infallibility is only infrequently seen. Okay. Life is short, science is long. Now, that said, one must concede that the theoretical differences notwithstanding, there was more in common between the two schools than there was different. Many of the methods employed that we discussed, used by the two schools, were used all, by both schools. They had different explanations for how cure was to be had, but nonetheless, they used pretty much the same methods. Now, Thomas Jefferson would have lined himself up neatly with the empirical medical tradition. He had a certain disdain of dogmatic physicians in his day. Consider this passage, a segment from a letter to Dr. Edward Jenner. He writes, Harvey's discovery of the circulation of the blood was a beautiful addition to our knowledge of the animal economy, but on review of the practice of medicine before and since that epoch, I do not see any great amelioration which has been derived from that discovery, while you have erased from the calendar of human afflictions one of its greatest. The reference here clearly is to inoculation. Jefferson's views can be found especially in a very important letter to Dr. Caspar Wister in 1807, and it, in a sense, summarizes his philosophy of medicine. Okay, he says animals' physical bodies, their bodily organs and functions are subject to derangement. He says, in this distorted state, we observe nature providing for the reestablishment of order by exciting some salutary evacuation of the morbific matter, or by some other operation which escapes our imperfect senses and researches. She brings on a crisis by stools, vomiting, sweat, urine, expectoration, bleeding, etc., which for the most part ends in the restoration of healthy action. Now notice here, Thomas Jefferson's language is entirely in keeping with Hippocratic and Galenic medicine. In the letter, which is a critique of the medicine of his day, he concedes some benefits to medical practice. He notes that the most successful doctors he's ever met follow nature, use nature as its guide. He writes, experience has taught us that there are certain substances which, when applied to the living body, internally or externally, we can at will produce the same evacuations, and thus do in a short time what nature would do slowly, and do effectually what perhaps she would have not have strength to accomplish. Now, by that he means that there are certain substances, perhaps certain medicines, that we physicians have learned through practice over time that can expedite what nature does naturally. He says if a disease is characterized by certain symptoms, is overcome by, say, a natural evacuation, then whenever that disease recurs under the same appearances, we may reasonably count on producing a solution of it by the use of such substances that we have found produce the same evacuations or movement. Now, in practice, a bloated stomach can be cured by emetics, intestinal problems by purgatives, inflammation by bleeding, a practice that was done until quite recently, syphilis by mercury, and washfulness by opium, among other things. Now he says, so far, I'll grant that, medicine, the physicians of my day have done us a great favorite. But he adds, the disorders of the animal body and the symptoms indicating them are as various as the elements of which the body is composed. He notes the combinations of symptoms are infinitely diversified, and the combination of symptoms makes the practice of medicine even more difficult. He says, to an unknown disease, there cannot be a known remedy, right? So experience here is important. But if symptoms sometimes pile up on symptoms, and we have numerous symptoms at once, and sometimes symptoms that are seen are symptoms that physicians are with which they're unfamiliar. How is a physician supposed to proceed in an enlightened and a helpful way? Now, Jefferson's answer in many respects is consistent with the answer that you find in Hippocratic Physicians. Note the response of this fellow from the Ancient Medicine, from the author of Ancient Medicine. I am utterly at a loss to know how those who prefer theoretical arguments and who reduce the science of medicine to an incox matter of principle ever cure anyone, right? In complex cases, clearly theory is superincumbent and not practicable. And Jefferson's approach is similar to the author of Ancient Medicine. He writes, here then the judicious, the moral, the humane physician should stop and let nature doctor. A physician ought to trust nature rather than hazard a greater derangement of the system by conjectural experiments on a machine so complicated and so unknown as the human body and a subject so sacred as human life. In such cases, an appeal to causes can have toxic consequences. Now, Jefferson was not averse to placebo therapy, and he said, let the placebo be the panpharmacon, the cure-all. He writes, one of the most successful physicians I have ever known has assured me that he used more bread pills, drops of colored water, and powders of hickory ashes than of all other medicines put together. It was certainly a pious fraud. I love the wording here, a pious fraud. Fraudulent practice with the aim of curing the patient by letting nature cure, in Jefferson's own sentiments. Now he says, let's contrast this pious fraud, this physician who uses sort of devious means. He uses placebos, to what Jefferson labels the adventurous physician. He says the adventurous physician substitutes presumption for knowledge. From the scanty field of what is known, he launches into the boundless region of what is unknown. He establishes for his guide some fanciful theory of corpuscular attraction, of chemical agency, of mechanical powers, of stimuli, of irritability accumulated or exhausted, of depletion by the lancet and repletion by mercury, or some other ingenious dream which lets him into all nature's secrets at shorthand. On the principle which he thus assumes, he forms his table of nosology, arranges his diseases into families, and extends his curative treatment by analogy to all cases he has thus arbitrarily marshaled together. Now, Jefferson warns that the young physician, the inexperienced physician, the young physician, ought not to try to establish a reputation by being adventurous. One must use common sense and let nature doctor when knowledge is wanting. He ought to know and ought to be apprised of the real limits of his art, and Jefferson thinks the art is certainly quite limited. Jefferson writes for complex cases. His office, and he's again talking about the inexperienced physician, is to be a watchful but quiet spectator of the operations of nature. Not a pathfinder, not a conquistador. He adds again, for the only sure foundations of medicine are an intimate knowledge of the human body and observation on the effects of medicinal substances on that. Now Jefferson concludes, the inexperienced and presumptuous hand of medical tyros let loose upon the world destroy more of human life in 1 year than all the Robin Hoods, Cartouches, and Macheaths do in a century. It is in this part of medicine that I wish to see a reform an abandonment of hypothesis for sober facts, the first degree of value set on clinical observation, and the lowest on visionary theories. So Jefferson had profound respect for medicine. As this letter to Caspar Wistar notes, but he also had his worries, his concerns, and it was a concern that was shared by the ancient medical practitioners as well, that one must not extend oneself beyond the limits of one's art. One must understand the very limits within which one is working. A successful physician, when he doesn't know, will let nature, follow nature and let nature try to heal. Instead of trying to put forth theories with all sorts of unknown words and complex causes to feign some sort of understanding in a discipline that's so highly complex. Now, if any of you are interested in learning more about Thomas Jefferson as a philosopher, I want to direct you to my website. That's www.thomasjeffersonphilosopher.com. That's one word, thomasjeffersonphilosopher.com. There you'll find this essay in readable form under philosophical, essays philosophical, under the rubric at the essays philosophical. You'll be able to read a number of other essays at your leisure that I have up for you to download, and learn more about me and Thomas Jefferson as a philosopher as well. Thank you very much.